Good morning, everyone. This is Dr. Thomas Bartell, board-certified plastic surgeon specializing in body recontouring surgery. Now, anyone who's been watching some of these episodes realizes that I do a lot of breast augmentation. This is my #1 operation. And I think I probably do the most of that around here of any of the surgeons. And there are a number of reasons for that, but we'll get to that. But there are also a number of reasons that women come to me requesting a breast augmentation. One of the most common reasons that they present is that they're a younger woman who's really never had breasts of any significant size. They've never really developed well, and they feel a little uncomfortable about that. They can't fill out their bra, they can't wear a nice evening gown, and they can't wear a bathing suit well without padding, and they want to do something about that. And that's certainly something that we can help them with. Another large patient population that I treat are women who may have had sufficient breast tissue at one time, then they got pregnant, breastfed, and guess what happens then? Everything kind of gets sucked out of them. And they're smaller, they've lost volume, they've lost firmness. They like the way they look when they were breastfeeding, or they certainly like the way they looked before they were pregnant, but now everything's different and they want it back. Well, guess what? That's something we can help you with too. A third population are women who may be happy with one of their breasts, but not the other one. Asymmetry is what we call it. Most women are a little asymmetric. Most humans are a little symmetric. You know, you draw a straight line down any individual. It's one ear's a little higher, one eye's a little lower, eyebrows this way. And most women come to me and breasts are just a little bit different. One is a little larger, one hangs a little lower. I always tell my patients, I can't give you mirror image symmetry. If she can't do it, I can't do it. But I know I can give you better symmetry. All three of these situations are cases where I can really help the patients, and I can do it without putting any scars on their breasts at all. We do this through a tiny little incision in the armpit that months later I can't even find. And if I tell folks, look, if I can't find it, I know what I'm looking for and I know where I'm looking. You can have your little arms up with your little bikini top on and no one knows I was ever there. I think that's so much better than having a permanent scar put on you underneath the breasts. And guess what? There's some good news. We have a new implant now. It's called the Ideal Implant. It is a structured implant. It's still saline, but it has the look and feel more of a silicone implant with the safety of saline. Now, one of the big advantages of this implant over the silicone implant is these implants are adjustable in the operating room, and that's very important, especially with the asymmetry issue. You never know exactly what size implant to put in if a woman is rather asymmetric, but with saline implants, and specifically the Ideal Implant, this implant is adjustable. I put in the amount of saline I want, I sit my patients up, and then I start to adjust things to try to get you the very, very best symmetry possible. And it has the feel of a silicone implant, the safety of a saline implant, and the adjustability. It also, by the way, is the safest implant out there. It has the fewest complication rates of any implant, silicone or saline. This is really the best implant. Now, the only problem that I've encountered with an Ideal Implant is they're becoming so popular that they're getting hard to get. But you know what? Since I'm now a premier Ideal Implant surgeon, they take care of me and I get my Ideal Implants on time. So anyway, that's basically what's going on today. It's a beautiful day out there. I hope you're able to get out and enjoy it. I certainly will. It's been a long time. I would love to stay and chat with you, but I've got to fly. So we're going to be getting in the plane in a little bit. Have to fly over somewhere because it's a beautiful day. I just can't stay on the ground when it's a beautiful day like this. So if you see a small little white plane flying around, what I'd suggest you do is keep your head down. Thomas Bartell, see you next time.